So when talking about injectables to relax muscles, the general term is called neurotoxin. Again, a word I don't like because it implies a little negativity when you use the word toxin. But in reality, it's not really a toxin because we're not really giving it in doses that's anywhere near toxic. It's essentially a purified protein that stays where I put it and does what I want it to do, and that is to relax muscles that are creating wrinkles. In doing so, we don't freeze anybody, we make sure it's natural, we just want to take away just enough movement so we're not crinkling the skin and making ourselves look old, angry, or aged. But what are all the toxins that are out there? Of course, everybody knows Botox, or should I say properly Botox cosmetic. There's also a Botox therapeutic that are used for muscle disorders. Botox is one of the most recognized brands in the world and was the first in the United States to come out. So Botox has an interesting history. It was originally used for a medical disorder, for fluttering eyelids, and the company that made it kind of didn't do very well, and they were essentially purchased by another company that made eye care products called Allergan. And it was very interesting when an ophthalmologist in Canada was fixing fluttering eyelids for one of her patients, she made the great observation that the wrinkles went away. And here was born Botox for cosmetic use. Very interesting story. Botox was actually been around since the 80s, but it wasn't until 2002 that the rest of the world learned about it. There was a group of people in the 90s, and myself included, that knew what Botox would do, and we were injecting it to get rid of wrinkles. It was kind of our little secret. But of course, for multiple reasons, the company wanted everybody to know about it, and it's now $1 billion blockbuster drug, still to this date, and one of the safest things you can do. In fact, I always tell people that are worried about the word Botox, isn't that botulism, isn't that toxin? Well, Botox is actually safer than Tylenol. More people actually have adverse reactions from Tylenol than Botox. So if you're willing to take Tylenol for your headache, you've actually taken a greater risk than getting a Botox injection. So what are the different types of medications in this category? We have Botox cosmetic. It has a very interesting brand name. The FDA has actually required people to use the brand name Onabotulinum toxin A. It's a mouthful. And just to make it more confusing, each of the other drugs sound almost the same and is almost an as arcane name. So trade names, Botox Cosmetic, made by a company called Allergan, market leader, is what most people recognize. We have a product called Dysport. Dysport actually has a history almost as long as Botox, but unfortunately that history was made in England and in Europe and really wasn't available in the United States until several years later, and is branded as Dysport, made by the same people that make Restylane. Interestingly, they actually wanted to name that drug Relaxin, which is a great name, Restylane and Relaxin. They had a whole brand campaign saying, get your R&R. And of course, our good old FDA said, no, we want you to call it a crazy name like Dysport, which is dysfunctional. And I don't know what port is supposed to mean, but I just want to make sure people are not scared by the names. Because again, Dysport is also a very safe, purified protein that delivers an excellent result by relaxing muscles that create wrinkles and giving people a great result. There's a company called Merz Pharmaceuticals that introduced a Botox type product called Xeomin, Xeomin. Xeomin is another good product. I've used it a little bit. However, I've had such great utility with Botox and with Dysport. I really haven't done a lot of Xeomin. I'm sure you'll find people that talk about it and think it's great. Just in my hands, I really don't see any advantage over the products that I use. Interestingly, there was a drug called Myoblock. Actually, even before Dysport and before Xeomin, that was actually the second drug that was introduced in the United States. You didn't have to refrigerate it. It lasted way longer than Botox, but alas, poor marketing, it has just essentially been kicked to the wayside. We've had a couple of new drugs that are making a lot of waves right now. First and foremost, a drug called Jeuveau. And this actually is made by a company that has brought a Botox-like purified protein from Asia, from South Korea, I believe, and they're now branding this as Juvo. And that's the company is actually branding this as Neurotox. And a lot of people have seen the Twitter moniker Neurotox. You know, where do I get my Neurotox? That's just kind of a cool little marketing spiel for Juvo. A lot of the people that have brought Juvo in the market are actually ex-Allergan employees, ex-Allergan executives, scientists, marketers, etc. So they have a nice seasoned team around this, and they've just done a really flashy launch that has hit the United States. So we'll see where Juvo lies, and I think it's just as efficacious as Botox, and I think the studies bear that out. But I think their model is going to be in pricing. They're actually offering it at a lower price to the doctors, and that will translate into a lower price for the consumers. And we'll see how that works. We have another company called Revance, which actually was trying to make a topical Botox. They thought, you know, instead of injecting you, they can just put this cream on you and the Botox will absorb through your skin. I don't think that worked, but they did find a product that actually gives great results with injection. We have another company that's making a Botox that interestingly doesn't last as long. And I'm not quite sure what the value of that is, but I guess that's what they're going to do. So we'll see what happens there. And more importantly, worldwide, there's probably half a dozen other Botox-like molecules that are out there. And some of them will likely come to the market or in various stages of FDA trials. So I think as we see this market go forward, I think consumers will have a lot more options. I do think it's very important that people go to a doctor who understands the differences from a medical perspective, and that there's no compromise on results to the patients, in exchange for marketing pizzazz or lower cost. So we make sure for all of our patients, we only offer efficacious products. If we can get a price break for our patients, awesome, we're going to do it. But we never forget that the result is the key thing. So a lot of stuff out there, and we're happy to help people sort through that and help them making decision when they're looking at a neurotoxin to help relax their muscles.